Hello guys and welcome back to Nextillo. This is Dr. Vishal and today we have with us our faculty of Obstetrics and Gynaecology, Dr. Vedi. She is mentoring students for both undergraduate and postgraduate examinations. Let us welcome her.
Hello, thank you for having me here.
Our pleasure, ma'am. So ma'am, whenever we talk about obstetrics and gynecology, it is a very vast subject, right? But the weightage is also
equally vast.
Yeah, equally high weightage. So what is the best precise way to approach obstetrics and gynecology in a very brief manner?
Okay. So one very important thing I would like to tell everyone is that obs and gynec include two subjects, and the weightage given to that subject is almost parallel to those of PSM, medicine and surgery. So most of the times students tend to ignore this subject and they forget that there are some basic fundas and principles which you need to learn for obs and gynec. So gynec per se, if you do certain selective topics very thoroughly, then most of the questions are covered. Same is for obs, that is you need to focus on certain fundas. Basics agar aapka clear hoga, then most of the questions you can solve on the basis of those fundamentals.
Right. Ma'am, what advice you want to give to undergraduates when they should start focusing on the basic obstetrics and gynecology?
Okay. So for me, if an undergraduate has to start preparing for obs and gynec, it begins from the clinical posting, which usually begins in the second year.
When it comes to students who are preparing for any competitive exams, what is your cut short advice? Because high weightage, vast subject, but I think most of the students will also agree with me that 100% strike rate is possible in obstetrics and gynecology.
Yes.
So how do you see this thing?
Okay, so obs and gynec, again as I said, it is a very vast subject, but if you are focusing rightly on a few topics and clearing those particular fundamentals, then I'm sure every student would be able to crack more number of questions out of the total number of given questions.
Right.
So it is kind of scoring, and the weightage is also very high, so you will be automatically above certain percentile.
So ma'am, what is your advice to students who are targeting entrance examination and who are going to study OBG from your video series at Nextillo?
Okay. So one very important thing I would like to tell the students that I have already covered all the basic things which they should be focusing on, and do not try to miss on the basic points, some things which are common. If you tend to make mistakes in the common questions, then automatically your rank falls behind everyone. So just focus on the common things. Later on you can add on into the difficult questions as well as the medium questions, but do not never ever make mistakes with the basic questions.
Right.
Also, the students should focus on the high yield topics, and I want to give one more advice to the students that especially for those who are preparing for the competitive exams. So during MCQ solving, most of the students, what they do is that they just see one relevant thing from the options and they will choose that and they will feel that it's very correct answer. But I would like to advise the student that you have to read each and every option, and from that you rule out the other options as well, so that you become double sure of that this particular option is correct and appropriate for that particular question.
Right.
So that method, I think it should be applied to each and every question while answering the paper, which I'll be noting down in the lectures. So keeping these few points in mind, I think students can do good in the obs gynec subject.
Right. Thank you so much, ma'am, for your precious advices. Thank you so much.